Hi everyone, my name is Madeline Freas and I completed my internship this summer at Onslow County Health Department in Jacksonville. Um, so just to talk a little bit about my internship experience, I'm going to go over the agency report, which includes the mission, the funding, what the agency does, and the professionals who work at the agency, and then I'm also going to give you some information about my responsibilities this summer and the different public health domains and competencies that I performed during that time. So, the mission of the health department in Onslow County is to deliver supportive, social, economic, protective, and health services that build better lives for individuals and families, and then to also provide education and clinical services to the community in order to protect health, prevent disease, and promote wellness. So, the health department has a number of different funding sources. So, federal and state funds. Sorry, that's thunder in the background. So, federal and state funds include grants and other different funding from both local government and federal funds. Medicaid is a major source of funding for many local health departments, and it actually provides direct reimbursement for services for Medicaid eligible clients. And then other county appropriations is another source of revenue for local health departments. And then other just includes fees for clinical services, environmental services, and just other fees that the health department include. So the main populations that the health department serves include the and underinsured individuals, so those with low income who may be on Medicaid or have other barriers to care. The health department also serves pregnant women. For example, the Pregnancy Care Management Program, which is a statewide program in North Carolina that promotes healthy mothers and babies. There's also a number of other services for women, including birth control, breast exams, and mammograms, as well as pap smears, and there is also a prenatal clinic. The health department also has an STD clinic. The health department provides child physicals up to age 20, which are performed by a registered nurse. There are postpartum and newborn home visits within 2 months of delivery. All childhood vaccinations for children ages 6 months to 18 years old who have Medicaid or are uninsured or underinsured will receive these immunizations for free at the health department. The health promotions team in community relations, which is where I interned this summer, is mainly responsible for education and outreach. Robin, one of the health educators, actually teaches a diabetes self-management class to employees of the health department, and she does a number of other outreach events and health promotion and education. So, as I mentioned before, the fees of the health department are normally based on income, so using a sliding scale. The health department accepts Medicaid as well as the majority of other insurances, but normally the fees for the health department are based on a sliding scale. So this summer, my time at the health department, I was able to work with a number of different public health professionals. There are about 330 employees total in the Consolidated Human Services, which include the health department and the Department of Social Services in Onslow County. I worked with health educators, part-time and full-time. I worked with and met with nurses, nutritionists, dietitians, other employees of the WIC office, the Women, Infants, and Children offices, who focus on nutrition for mothers and babies and infants. Environmental health specialists, case managers, there's a large variety of public health professionals with different backgrounds at the health department, and that was very interesting for me to see how all of their roles came into play to best serve the community. So this summer at Onslow County Health Department, I was able to dip my toes in a lot of different projects and be involved in many different outreaches. So these are just some pictures of some things that I worked on. This is at the farmers market. We did some community health needs assessment surveying. The weekly wellness newsletters were some educational materials that I created for the employees of the health department. Blood Pressure Take It to Heart was my priority project, as well as my capstone. This household hazards board I created for the health department to use at National Night Out, which is a big outreach for the health department in Jacksonville. And then this is just another flyer I created for a different outreach, but I'm going to go into more detail about my projects and responsibilities. So my responsibilities this summer, I created health promotion materials, and that included the household hazards board, the weekly wellness newsletters, my blood pressure materials that can be used at outreaches, and just other little projects here and there. I participated in a number of outreaches, and I was able to teach a lesson on hand washing to teachers at one of the meetings, or I guess it was kind of like a seminar for teachers K through 12 to teach them ways that they can incorporate hand washing into their own curriculum. So that was pretty cool. I attended, like I said, a number of meetings. One was for an opiate grant to target the opioid epidemic in Onslow County, so that was very interesting for me. I assisted the health educators and other members of the community relations and health promotions team with a number of projects here and there, and I focused on my priority project, or my capstone project, which was my education materials for my health campaign called Blood Pressure Take It to Heart. I'm going to go into more detail about that. But so Blood Pressure Take It to Heart, I created educational materials to be used at outreaches with the long-term goal of decreasing uncontrolled high blood pressure in residents. So that was my capstone as well. And I chose this as my project based on the previous community health needs assessment. Also, we were able to be involved with the current community health needs assessment, which was super interesting for me to be able to be a part of that. I was able to take notes for three of the focus groups, and I actually transcribed all of the notes for all of the focus groups that were completed. So that was very interesting to be a part of. I helped distribute CSAP cards, which is for the Coastal Coalition for Substance Abuse Prevention, and these are just information cards that were designed for first responders to use. And then I also helped design different flyers for some of the blood pressure programming that's actually happening at the Naval Medical Center. So these are just a list of the different public health domains that I used this summer. So I assessed needs and allocated resources. I did my research for my capstone and other projects. I developed my goals and objectives. I selected my design based on evidence based research. I developed a plan for my delivery of the pilot test at the diabetes walk of my blood pressure materials in combination with screening that was provided by the hospital. And then I was able to implement my pilot test. And then finally, memorable experiences, just outreaches and getting involved in the community, being able to dip my toes in a lot of projects, as I mentioned, getting to meet a lot of different public health professionals with different backgrounds. And then I think my favorite part about the internship, or one of my favorite things, was being involved in the community health needs assessment and the surveys and the focus groups. One thing I would mention was that I had a lot of downtime and independence, and I would have liked to work more as a team and as a group. So yeah, that was a little bit about my internship.